the third, I think, Grange National Conference that I've had the pleasure to speak at. And I need to tell a funny story because I tell this at other meetings, but it's about the Grange. Several years ago, after the passage though of Medicare Part D in 2003, the Grange had a meeting, and I think it was maybe just for state masters in Orlando. And it was a warm place, and it was a Saturday night, and my topic was Medicare, and the dinner was turkey and dressing, and I know I was the only person awake in the entire audience. If one of the servers were in here now, she would tell you that I said, tell me what people are having for lunch, because I thought maybe I'd have to sing or dance or do a little juggling. And that's really what I do, I juggle. My job at PhRMA is to be the relationship manager between the Pharmaceutical Research Manufacturers Association and a variety of different kinds of advocacy groups. Early in my career, I had the great pleasure of meeting with Roy Watson, and so I knew about the Grange. I knew about the Grange from my American history class, but I knew about the Grange really from meeting with Roy. And since that time, I've had a chance to meet so many wonderful leaders in communities all over the country. And I want to just stop for a minute and talk from the perspective of what the pharmaceutical industry and many other industries see when they see the Grange. The first word that came to mind was integrity. It is an organization that has a set of principles that has allowed it to evolve over time and remain relevant, but remain true to its founding principles. There are very few organizations that can say that, and I think it's incredibly important to that. When the Grange gives its support to something, it's because they believe in it, not because they've been involved in backroom deals. Not that there really are that many backroom deals, but there would never be a question about that. Secondly, the Grange has a unique voice. There are really no other organizations which represent rural culture in our country. There may have been in the past, but there are no more. That unique voice is critically important, never more so than today. And then third, in the fact that it represents rural society, the Grange has a nexus of a variety of different kinds of groups which come together to make up that society. There are significant percentages of veterans, owners of small businesses, and seniors who live in rural America, disproportionately so, so that when the Grange speaks, its voice is magnified by the nature of the constituency it represents. I hope that each of those things which we perceive when we work with you, we being on the outside, really resonate in terms of the power of your organization. And I hope that every time that you do have an interaction with someone who you're lobbying or influencing, that you take the time to help them sort through all of the different constituencies that are represented by your membership. Going past that, I wanted to talk for a minute about the history of the Grange's involvement in Medicare. One of the first groups to step forward to help straighten out, explain, interpret, and otherwise hold hands in the vast change that Medicare Part D represents was the Grange. Many people, including Dick Weiss, who was in that video, traveled around the country, and many Granges around the country held meetings to help seniors and disabled people who were on Medicare understand the profound changes that were brought about by Medicare Part D. And I won't belabor all of them, but I just want to say two things. Medicare used to work, just not that long ago, by your going down to the office for a meeting. The idea that you could go online and see every plan you could buy and every drug in that plan and every pharmacy that cooperated is mind-blowing. And when we first started talking about it, I also confess to you, I never dreamed CMS could come up with a website that anyone short of a PhD from MIT in information technology would be able to use. But you can use it. And I have used it. And the Medicare toll-free number used to operate at the very beginning, 24 hours a day. I was flying around the country a lot. So if I got stranded in an airport and it was 1 o'clock in the morning, I would just call and ask questions. Now, I think after a while, they kind of got onto me, but I asked useful questions. I would ask questions that people had asked me, or I wanted to see how they explained something compared to the way I explained it. But, and they didn't block my number, for which I'm grateful, because I was going to have to get another cell phone. But it is really a big story that healthcare comparison shopping truly had a gigantic step forward with the passage of Medicare Part D. Another thing is that, unlike many other healthcare costs, the premiums for Medicare Part D have risen moderately. I would say almost a little bit to the shade of moderately, because a couple of years they were even a couple pennies less than the year before. That's the average premium. And earning a 90+% satisfaction rate for any government program is pretty amazing. So there are a lot of reasons why Medicare Part D is a success story, apart from the clinical reasons in which people who didn't have medicine before had access to medicine. A third of the people who were eligible for Medicare had no prescription drug coverage. I cannot imagine being sick and not having coverage for medicine. But in the 1960s, when Medicare was passed, there were far fewer medicines, they did far fewer things. So the idea of the way in which medicine works today versus in the 60s is significantly different. So the passage of Medicare is a big story. I'm not going to put people to sleep talking about it anymore. But the Grange itself has an integral part in that success story and in that history. For those little meetings in Grange halls where state health information insurance program peopleships came and helped counsel people, where enrollment activities took place. And I would say to you, please don't stop. There are, and I'm going to end talking about something completely different because I had breakfast with Leroy, and as he often does, he takes my ideas and just turns them 180 degrees, and I spent the rest of the morning rewriting what I was going to say. Please don't stop. The work that you do in communities to help new people understand Medicare Part D, hopefully through the video, which I hope you will use for information, is huge. There are still 1 out of 10 seniors in this country who are eligible for Part D Medicare who have not signed up. For the life of me, I have no idea why. Neither does CMS. People have done everything except stand on their heads. But if there are people who are fearful for whatever reason, what a difference in their life you can make. Men live, I looked this up, let me just make sure I get it right. Since the passage of Medicare itself, the life expectancy from age 65 forward for men has increased 4 years, but ladies, we got 7. It is about access to health care and treatment. There are already studies, and Medicare Part D passed in 2003, really didn't start to be implemented till the beginning of 2006. So the earliest studies are starting to come in, and it has saved money, and it is contributing to health, and it is driving down hospital admissions. But the long-term effect is going to be even more dramatic. There's just not enough time has elapsed to look at those studies. So please, if you are considering doing a program at your local Grange, please consider using that video, and please look at the materials and see if there's something there. Whether you follow our materials or anyone else's, advancing coverage and access to care for people who need it is a very worthwhile goal, and the Grange has done such an exceptional job of it, and all of us are very grateful. And now to the part where I changed my speech. One of the things that I really was going to talk about is what the challenges are that face healthcare in the coming years. And it is not really possible to talk about that without talking about the competing issues or competing pressures or competing attention-grabbing ideas, concerns, and problems that are going to be butting heads with it. And so I just want to spend a couple minutes talking about that. In this particular end of the year cycle, while seniors are changing or renewing their Part D subscriptions, we're also facing, and I hate to use the word financial cliff, and I read two articles recently that said it's really not a cliff, it's a slope. Whatever it is, we're facing it. And it is just really the tip of the iceberg. The competition between scarce resources to pay for things, the rising number of eligible people for entitlements, and the innovation which my industry hopes to continue to drive is heading for each other headlong at breakneck speed. In my industry, in the pharmaceutical industry, people are searching for cures for Alzheimer's. They're not there. They're not, I wish they were. But there are hundreds of medicines in stage 2 and 3 clinical trial. Medicines that will change the lives of a lot of people. And the trend is to use medicines to prevent the onset of illness, not just to treat it. That's one of the major differences between medicine in the 60s when Medicare was first created and today. And the trend also is toward personalized medicine, so that the science learned from the human genome is applied directly to the patient. Nowhere is that more clearly illustrated in the way in which cancer tumors are now biopsied to look at their genetic makeup, and individual therapies are put together to address them. We're just at the beginning of that. We're just taking baby steps, and we're already changing medicine. But it's expensive. And we have a system of reimbursement and payment in the part of Medicare that wasn't updated that really works in opposition to that, and here's why. Let's say that, God willing, a year from now, somebody invents a pill that goes in your brain, and you take it and it binds to your brain cells and it keeps the plaque from building up that causes Alzheimer's. That would be pretty amazing. And over the next 40 years, it'll save, I don't know, $40 billion. It'll save more than that, but $400 billion is more like it. But the first couple of years, it's going to cost a gigantic amount of money to administer it to everybody who's at risk. There are already mechanisms in place which will allow for that to happen, because it will drive up the cost of medicine in a short term for a long-range goal. That entity is called the Medicare Independent Payment Advisory Board, and I spend a lot of my time trying to explain it to people, and I won't do it after people have eaten because all of you will be asleep. But I thank the Grange for their interest in that issue and the work that they have helped do on it. So there is the issue of entitlement reform. There is the issue of the financial cliff. We have tax issues. We have budget issues. We have a variety of things that are coming to a head. And over the long run, we have other issues to deal with. We have immigration. That's going to be a big issue in the next 2 years. We have additional Medicare reform in the terms of how we reimburse doctors, a gigantic issue, and if I were a physician and I was standing here, I would have been trying to make you jump up and down about the physician reimbursement system. There are so many healthcare issues that remain, so many other issues in the economy that remain, and so many other public policy issues that affect domestic policy that remain. And all of us have to compete for the resources to do the work and the attention of the legislators who make the laws. And I live in Washington, D.C. Now, I know about gridlock when I drive into the city, but we also have had political gridlock, and we will probably continue to do so for a while. So it is a very precarious time. And the people who can break the logjam are sitting in this room. You and other advocacy groups. I work a lot, and I'm very privileged to work a lot with patient advocacy groups from a variety of different disease categories. You break the jam, because when you go and say, this is a problem and it needs to be fixed, and I'm speaking for the Grange, people listen to you. So I thank you for the amazing work that your organization has done, the leadership role it has played in Medicare. I ask you to please consider protecting that work that you've done and protecting access for seniors to medicines, protecting the competitive nature of that marketplace in Part D, which has kept premiums low, satisfaction high, and formularies full of new medicines. And then I ask you to stand tall on the other issues that are going to be important to the people who are your neighbors and friends, because that's what the Grange has always done. And I appreciate so much the opportunity to be here. And I'm going to close with a little anecdote, again, it's a Grange story. I have a lot of them. When I was going to, actually, again, the Grange meeting in Orlando, I got in a little shuttle bus to go to the hotel with a young man in his late 20s who had obviously spent some time at the bar before he got in. And he was talking to the taxi driver, and he lived in Illinois, and he and his wife were separated, and they had been married not maybe just quite a year, and they had already bought tickets for a cruise, and they were separated, and he was coming to go on the cruise with her because he had paid for the ticket. Now I had to try to wrap my brain around that, but he had spent too much time in the bar and he missed his flight, and so he was trying to get to Port Canaveral to catch the boat, and he was clearly going to miss the boat. And I looked for several days after he got to the shuttle that went to Port Canaveral to see if there was a male body thrown off of a cruise ship, because I want to know what happened when he finally caught up. But my point in that was that in the passage of Medicare Part D and in the passage of the Accountable Care Act, the boat has sailed. And it is really important that everybody who's on the cruise, and that's every one of us, knows where we should know where the bathrooms are, we should know where the emergency equipment is, we should know where the free food is, we should know where the entertainment is. So it's really important that every one of us knows what are the passages that affect us, what are the problems that are presented to us, and where are we going to go for answers, help, and resources. And I hope, and I really thank you for allowing PhRMA to partner with you, and I hope that together we explore the ships that have sailed that we're both on. Thank you so much.